You know, with record numbers of Americans contracting the virus, more and more are being required to stay home and quarantine.
Whether you're actually sick or were potentially exposed, quarantine can come with a whole host of things to think about, like time off work or getting groceries. It can be hard for a lot of people. Genevieve Ellis is the Quarantine Support Program Supervisor for Washington County. She joins us live this morning to talk about some of the help that is out there. Good morning.
Good morning.
So what kinds of resources are there available to people who either test positive or, they're close contacts? It's not just people who actually have COVID-19 that have to stay home.
That's correct. And most people don't realize that Washington County and other counties are providing financial support for people to be able to stay home. And that includes rent or mortgage, utilities and other bills, and then paying for food and getting groceries delivered for people.
Yeah, because I would imagine that a lot of people don't necessarily get paid while they're having to stay home. So how many people has the county helped, and what is the need right now?
The need is really high. Probably about 20% or a little less of people that we talk to that are being required to isolate or quarantine identify some sort of need for resources. And we've helped about 2,000 families since the start of this program in June, so quite a few.
I know the Latinx community has really seen a great need among that population. How are you serving certain at-risk populations and those maybe with language barriers where it might be difficult to contact trace?
Right. We're working closely with community-based organizations out in Washington County. Many of them work with the Latinx population, know their communities really well. And we also have all of our staff are bilingual, all of our resource coordinators. So the majority of them speak Spanish and several speak Vietnamese or Mandarin. So we do have bilingual staff and we're able to use interpreters, but really the main part is partnering with these organizations that can offer that culturally responsive support to community members.
Yeah, you guys are doing a lot of work. You know, is it possible? We've known a lot of people personally who maybe someone in the family tests positive, but then the rest of the family doesn't, and they're all in the same house. Is it possible to prevent spreading the virus to other family members when you're all together in a home?
It is possible. We know this is hard, especially for families that don't have a separate room or a separate bathroom. Mask wearing is huge, washing hands, cleaning and disinfecting spaces. And then also you can put up a tent or a barrier, even hanging a sheet to kind of separate the person who's sick from the rest of the household. Any of those barriers are going to be helpful in preventing transmission.
Huh, interesting. That's good to know.
Yeah.
I think, you mentioned off the top of the interview here that there is financial assistance available. I do want to stress people don't need to be unemployed to receive that assistance. How can people reach out and what resources are available for them?
That's correct. If you do test positive, your county should have a phone number that you can call. Most counties are calling people directly to let them know that resources are available, and this is true for contacts as well. As the numbers get higher, I think the lag time gets a little bit longer, but counties will get in touch with people who are cases or contacts. And then you can just let the person that you're talking with, the contact tracer or the case investigator, know that you need support to be able to stay home. And it's true that folks that are working but maybe don't get enough sick time would qualify for this support. So there's a lot of different ways to qualify.
Yeah, good information, because I'm sure there are a lot of people in that situation.
Genevieve, one other question, as someone who's working in public health right now, who is working around the clock to try and contact trace to prevent the spread of this virus, how do you feel when you hear other elected officials? We just had an elected official in Clackamas County. I know it's not your county, but talk about getting together with friends and family for Thanksgiving dinner. I mean, how do you feel as someone who's working to try and prevent this virus from spreading when you hear stuff like that?
Well, I know this is a hard time for a lot of people, but as someone who's working in public health right now, I can just see how stressed my coworkers are and how dire the situations are. So I think this is a really critical time. As you mentioned before, there's a lag between when we see cases start to rise and when we start to see hospitalizations and even deaths. So now is not the time to be gathering with friends and family.
Yeah. Okay. Well, we appreciate your information and your comments. And again, Quarantine Support Program Supervisor Genevieve Ellis, thank you for your time this morning.
Thank you.
Yeah.